Welcome to Have More Babies, the show dedicated to diving deep into topics that truly matter to you and your family. Today we're tackling a health issue in children that's, well, far more common than many parents realize, yet often gets overlooked. Gingivitis. We hear a lot about cavities, maybe braces, but the health of our children's gums. Sometimes that just flies under the radar. And the reality is, gum inflammation is surprisingly prevalent, even in little ones. We've been looking closely at an incredibly insightful guide from Omega Pediatrics titled Gingivitis in Children, a comprehensive guide to prevention and treatment. It's really packed with crucial, actionable information. And our mission today is to sort of distill those essential takeaways into a clear, concise conversation for you. To help us navigate this vital topic and unpack the nuances of this guide, we have our brilliant expert speaker with us.
It's wonderful to be here. I'm really looking forward to this discussion. This particular focus on children's gingivitis is, I think, a fantastic example of how early awareness and proactive intervention can make a huge difference in a child's overall health, not just their oral health. What's truly fascinating in this guide is how clearly it lays out not just what gingivitis is, but the why it happens, the how to spot it, and the how to manage it effectively for parents. It's very practical.
Absolutely. Today, we're really looking to challenge some common assumptions and hopefully equip you with the knowledge to recognize, prevent, and treat gingivitis, ensuring those precious little smiles stay healthy for years to come. So let's start right at the very beginning. What exactly is gingivitis? And why should parents be paying such close attention to it in their kids?
Okay, so at its core, gingivitis is the mildest form of periodontal disease. Now, that's a crucial distinction. It refers specifically to inflammation and redness in the gums, right around the teeth. Many people tend to associate gum disease mostly with adults, often thinking of more severe conditions. However, the Omega Pediatrics Guide really emphasizes that gingivitis absolutely affects children too. It's that initial, often subtle signal that something might be, off with gum health. It's a critical early warning sign, and if you catch it then, it can prevent a whole cascade of more serious issues down the road.
Right.
Unlike its more severe cousin, periodontitis, which involves bone loss, gingivitis is still completely reversible. That mild status is really our window of opportunity.
And that's where it gets really interesting for me. It's not just superficial, like how it looks.
Yeah.
Right? We're talking about actual inflammation, which sounds much more serious than just red gums. It's a real biological reaction happening there, what's actually going on.
Exactly. It's an immune response, basically. When plaque, which is this complex bacterial film constantly forming on teeth, isn't removed regularly and thoroughly, these specific bacteria start producing metabolic byproducts. Think of them like toxins. These toxins directly trigger the body's immune system. And that immune response manifests as the inflammation we see. The redness, the swelling, sometimes tenderness.
Oh, okay.
So while it might just look like a surface issue, it's actually an active battle happening in the gum tissue. And if you leave it unchecked, that battle can become, much more disruptive.
So understanding why it happens is clearly key for prevention. The guide really points to inadequate oral hygiene as the main culprit. But sometimes parents feel like they're doing everything right, brushing twice a day. But these issues can still pop up. Are there other surprising factors?
Absolutely. It's not always just about not brushing enough. While poor oral hygiene is the leading cause, the Omega Pediatrics Guide does a great job highlighting other significant contributors. Dietary habits, for instance, play a much bigger role than many parents might realize.
Like sugar.
Exactly. Sugary and starchy foods essentially provide a feast for the bacteria in plaque, helping them multiply faster and produce those harmful toxins more effectively. And it's not just what they eat, but also how often they're snacking on these things. That keeps the mouth in an acidic, bacteria-friendly state for longer.
That makes perfect sense. Constant exposure.
Yeah.
Yeah. What about things totally outside of diet and brushing?
Well, something else highlighted, and this often surprises parents, is the impact of hormonal changes, particularly during adolescence. Puberty brings that surge in hormones.
Right, teenagers.
Yeah, hormones like estrogen and progesterone can increase blood flow to the gums, making them more sensitive, more reactive, and just more prone to inflammation, even with the same brushing habits a child has always had.
So a teen could suddenly get it.
Yes. A teenager who previously had perfect gum health might suddenly experience gingivitis. It might mean they need, an adjustment in their routine or maybe more frequent professional cleanings for a while. And then in some cases, underlying medical conditions can significantly increase susceptibility.
Like what?
Things like diabetes, certain immune system disorders, or even some medications can compromise the body's ability to fight off bacterial infections. This makes the gums much more vulnerable. So it raises an important question. Are we looking beyond just brushing technique? Are we considering the whole picture of a child's health when we see persistent gum issues?
That's a really critical point about the bigger health context.
Yeah.
So, okay, what does this all mean for busy parents? Parents already juggling a million things.
Yeah.
Try to keep track of school, activities, general well-being. They might miss some of these less obvious things. So for those parents, what are the absolute, non-negotiable red flags they must look out for? What can they actually see? Because kids might not say, my gums hurt.
That's a great point. Kids often don't complain until something's pretty bad, or they might just not notice the changes themselves. So parents really need to be the observers here. The first and most common indicator, as the guide points out, is red, swollen gums. Healthy gums should be firm and pale pink. If you see gums that look puffy, maybe a darker red, even purplish red, or seem tender, especially right where they meet the teeth, that's a clear signal. It's not just minor irritation, it's a symptom.
Okay, redness and puffiness. Got it.
Another big one, and this is where a lot of confusion comes in, is bleeding during brushing or flossing. Many people, even adults, mistakenly think, oh, I must be brushing too hard or flossing too rough.
Yeah, I've heard that.
But healthy gums do not bleed. Bleeding is a definitive sign of inflammation and irritation. It means the tissue is compromised. So if you see any pink or red in the sink after your child brushes, or if flossing causes bleeding, that's a definite red flag for gingivitis. Don't ignore it.
That's such an important distinction about the bleeding. Wow. Okay,
Yeah.
what else? Anything less obvious but still important?
Persistent bad breath, halitosis, can also be a sign. Now, morning breath is normal, sure, but if your child has bad breath throughout the day despite brushing, it could be from the bacteria thriving in the plaque around their gums. It's a different kind of smell.
Okay.
And while it's less common in kids than adults, receding gums can sometimes happen. That's when the gum tissue pulls away from the tooth, making the teeth look longer. It's a more advanced sign, but definitely something to note if you see it, as it can lead to sensitivity and other problems. Really, all these symptoms are the body's way of sending up a flare. They shouldn't be dismissed, even if they seem minor at first, because catching it early makes it so much easier to fix.
So, okay, a parent sees some of these signs, they suspect something's up. What's the very next step? How is it actually diagnosed? And crucially, what does treatment look like? Because gum disease sounds scary for a kid.
Right. It sounds alarming, but the guide is reassuring here. It is manageable. The diagnosis usually starts with a thorough dental exam. A dentist, ideally a pediatric dentist, will look closely at the gums, the color, the shape, the texture. They'll also gently probe around the teeth.
Probe, what does that mean?
It's just using a tiny measuring tool to check the depth of the little space between the gum and the tooth, the gum pocket. Healthy pockets are shallow. Deeper pockets can indicate swelling. It doesn't hurt. They'll also check for plaque and tartar buildup and look for any bleeding when the gums are gently touched.
Okay. Do they always do x-rays?
Not usually for mild gingivitis in kids. X-rays are mainly used to check for bone loss, which means it's progressed beyond gingivitis to periodontitis. That's rare in simple gingivitis. So X-rays might be taken to rule out other things or just check overall development, but not typically just for suspected gingivitis. And blood tests. Very rare. Only if the dentist suspects an underlying medical issue contributing to it, like, say, uncontrolled diabetes.
Gotcha. So diagnosis sounds pretty straightforward. Once it's confirmed, what's the plan? How do you treat it?
The really good news is that gingivitis is highly treatable, and, this is key, completely reversible when caught early. The main treatment, as the Omega Pediatrics Guide highlights, is really stepping up the oral hygiene game. This means thoroughly teaching and, importantly, supervising proper brushing and flossing techniques.
So it's more than just telling them to brush.
Oh yeah, it's about the method. Using a soft brush, angling it towards the gum line, making sure all the surfaces and the gum line itself are cleaned effectively, not just scrubbing the tops. And flossing daily is just as crucial to get the plaque out from between the teeth where the brush can't reach. Sometimes those disclosing tablets can be great. They stain the plaque purple or red so kids can actually see the spots they missed. Makes it a bit of a game.
That's a neat trick. What else besides home care?
Well, beyond home care, a professional cleaning by a dental hygienist is often essential. They can remove the hardened plaque, that's tartar or calculus, which you just can't brush off at home. This cleaning, called scaling, gets the teeth really clean, even slightly below the gum line, and gives the gums a chance to heal properly.
Okay.
In some situations, maybe if there's a lot of bacteria, antibacterial mouthwashes might be recommended, either over-the-counter ones or sometimes prescription rinses like chlorhexidine. And the guide also mentions dental sealants. Now, sealants are mostly for preventing cavities on chewing surfaces.
Right, the molars.
Exactly. They create a barrier. While they don't directly treat gingivitis, they help overall hygiene by making those tricky spots easier to keep clean, which indirectly helps gum health. Antibiotics are rarely needed for just gingivitis. That would be for more extreme cases or if there's a suspected systemic infection. The focus is really on cleaning and daily habits.
It sounds like, given how treatable and reversible it is, the absolute best approach is just prevention, avoiding it in the first place. So, what are the most effective strategies for parents to prevent gingivitis in their children, keeping all these causes and factors in mind?
You've hit the nail on the head. Prevention is the best cure, and thankfully, it's largely within a parent's influence. The guide really boils it down to 3 main pillars. First, regular dental checkups. These are non-negotiable.
Not just for cavities.
Exactly. They're crucial for monitoring gum health, catching any issues super early, and establishing what dentists call a dental home for consistent care. These visits let the dental team give proactive advice, do professional cleanings, and just reinforce those good habits. Second pillar, promoting a balanced diet. This means really limiting sugary and starchy foods and drinks.
The fuel for the bacteria.
Precisely. Sugars feed the bacteria that cause plaque and gingivitis. And it's not just candy. Watch out for hidden sugars in processed foods, juices, even snacks that seem healthy. Encouraging water, fruits, vegetables, whole grains. It makes a huge difference for their gums and their whole body.
Makes sense. And the third pillar?
Consistent oral hygiene education and supervision. This isn't a one-and-done talk. It's an ongoing process that changes as the child grows. For little kids, parents need to do the brushing and flossing for them. As they get older, it shifts to supervising, teaching the right techniques, making sure they're doing it for the full 2 minutes, twice a day, and flossing daily. Making it a consistent, non-negotiable part of the routine, and importantly, modeling good habits yourself. That sets the foundation.
It really empowers them for the long run. So what does this all mean for you, the listener, as a parent trying to give your child the healthiest start possible? Our discussion today about children's gingivitis really highlights how preventable and treatable this common condition is. With more awareness of the causes, those often subtle symptoms, and the simple but really powerful steps for prevention and treatment, we can empower ourselves to help our kids maintain healthy, happy smiles. It's about being proactive.
Indeed. I think the key takeaway from the Omega Pediatrics guide is just that. With timely action and consistent effort, gingivitis can be completely reversed. This safeguards a child's foundational oral health for years to come. It's a vital investment in their overall well-being and really sets the stage for a lifetime of healthy habits.
Absolutely. And for more comprehensive information on everything we've talked about today, and also to explore a full range of pediatric services tailored to your child's health journey, we strongly encourage you to visit omegapediatrics.com. They are just an incredible resource for everything from acute and preventive pediatric care to essential immunizations, compassionate lactation services, even medical ear piercings. That's omegapediatrics.com, truly a partner in your child's health. We really hope this conversation has given you some valuable insights and, most importantly, some actionable steps you can take to protect your child's oral health. If you found this discussion helpful, please remember to like this video, subscribe to our channel for more conversations on critical health topics, and maybe share it with other parents who you think might benefit from this essential information.
Thank you for joining us on Have More Babies.
And as you think about the health of your child's smile today, maybe consider this. The state of their gums isn't just about their mouth. It's often a silent, early indicator of their overall health habits and a crucial component of their well-being throughout their entire life. Healthy gums really are a foundation for a healthy body. What small, consistent change can you commit to today to foster that lifelong health and ensure that radiant smile?